The World Health Organization estimates that there are 1.28 billion adults worldwide who have hypertension. This is concerning because having hypertension puts you at risk for lots of other far worse conditions like strokes, heart failure, heart attack, and kidney failure, to name a few. The good news is, hypertension is treatable with medication, lifestyle changes, exercise, and proper diet. In addition, you can also keep your blood pressure in check with the help of certain vitamins. In this video, we will talk about the 5 vitamins that can help lower high blood pressure. Watch out for the number 1 item on our list, as it may be something you are deficient in. A quick reminder, always consult your doctor before taking any vitamins, especially if you are on hypertension medications. Now, let's start our list of 5 vitamins, starting with number 5, vitamin C. Vitamin C is a powerful antioxidant that may help lower blood pressure by increasing the production of nitric oxide, a compound that relaxes blood vessels and improves blood flow. A 2023 meta-analysis of 20 studies with 890 participants found vitamin C supplementation reduced blood pressure in patients with hypertension and diabetes. The analysis included 29 randomized controlled trials with over 1,400 participants. The median dose of vitamin C was 500 milligrams per day, and the median duration was 8 weeks. The mechanism is thought to be related to vitamin C's ability to enhance nitric oxide bioavailability in the endothelial cells that line blood vessels. Some of the best food sources of vitamin C include citrus fruits like oranges, grapefruits, lemons, and limes, berries such as strawberries, raspberries, blueberries, and blackberries, red and green bell peppers, kiwi fruit, leafy greens like spinach and kale, broccoli and cauliflower, and tomatoes. The recommended dietary allowance, RDA, for vitamin C for adult men is 90 milligrams per day and 75 milligrams per day for adult women. However, higher intakes of 500 milligrams or more per day may be optimal for lowering blood pressure based on the research. You can meet this target by eating a variety of vitamin C-rich fruits and vegetables every day. If your diet falls short, a supplement can help fill in the gaps. Next on our list of vitamins that help lower high blood pressure is number 4, vitamin D. Vitamin D has been linked to blood pressure regulation, and people with high blood pressure often have lower levels of vitamin D compared to those with normal blood pressure. A 2022 systematic review titled Serum Vitamin D Levels in Relation to Hypertension found that a 16% decrease in risk of hypertension was observed in participants with high levels of serum vitamin D compared to low levels. Vitamin D may help regulate blood pressure through its effects on the renin-angiotensin system, a hormone system that plays a key role in blood pressure control. Vitamin D is thought to suppress renin production and activity, which could lead to lower blood pressure. The best way to get vitamin D is through sunlight exposure, as UV rays trigger vitamin D synthesis in the skin. However, you can also obtain vitamin D through dietary sources such as fatty fish like salmon, mackerel, sardines, and tuna, cod liver oil, egg yolks, mushrooms exposed to UV light, and fortified foods like milk, orange juice, cereal, and yogurt. The RDA for vitamin D is 600 to 800 IU, 15 to 20 micrograms per day for adults. If you have low vitamin D levels or limited sun exposure, your doctor may recommend higher doses through supplements. The next item on the list is more than just one vitamin, rather a family of vitamins. It's number 3, B complex. Several B vitamins, including folate B9, vitamin B6, and vitamin B12, have been shown to help lower blood pressure through various mechanisms. Folate, also known as folic acid in its synthetic form, may help lower blood pressure by increasing nitric oxide synthesis, which relaxes blood vessels and improves blood flow. A 2009 meta-analysis published in the Journal of Clinical Hypertension found that folic acid supplementation of at least 5,000 micrograms per day for a minimum of 6 weeks significantly reduced systolic blood pressure by 2.03 millimeters of mercury in hypertensive individuals. The recommended daily intake of folate for lowering blood pressure is 400 to 800 micrograms per day. Good dietary sources include leafy greens, citrus fruits, beans, and fortified grains. Animal studies also suggest that vitamin B6 has blood pressure lowering effects, possibly by decreasing calcium influx into vascular smooth muscle cells. Good sources of vitamin B6 include poultry, fish, potatoes, and non-citrus fruits. You might also find it interesting to know that having low vitamin B12 levels is linked to an increased risk of hypertension. This is supported by a 2023 study, which found that higher dietary intakes of B12 were significantly associated with a lower prevalence of hypertension in U.S. adults. Vitamin B12 is found naturally in animal foods like meat, fish, eggs, and dairy. Vegans and vegetarians may need to supplement with B12 to maintain healthy levels and potentially lower blood pressure risk. Ensuring adequate intake of folate, vitamin B6, and vitamin B12 through a balanced diet or supplementation may help lower blood pressure as part of a heart-healthy lifestyle. However, more research is needed, especially for vitamins B6 and B12. Now, this next vitamin, you might know best for its effects on the skin, but you'll be glad to know that it helps lower high blood pressure too, and it's Number 2. Vitamin E. Vitamin E is a fat-soluble nutrient that acts as a powerful antioxidant in your body. It has also been found that vitamin E intake can help reduce mild hypertension. A study titled The Effect of Vitamin E Supplementation on Mild Hypertension, published in the Journal of Kermanshah University of Medical Sciences, examined the effects of vitamin E supplementation on blood pressure in people with mild hypertension. Over 27 weeks, 70 participants were divided into two groups, one receiving 200 IU of vitamin E daily and the other a placebo. The results showed a significant difference between the groups. Those taking vitamin E experienced a 24% decrease in systolic blood pressure, compared to only a 1.6% decrease in the placebo group. Diastolic blood pressure also saw a more substantial reduction in the vitamin E group, 12.5%, versus the placebo group, 6.2%. So, should you take vitamin E for high blood pressure? Yes, but also, it's best to talk to your doctor first. While vitamin E is generally safe, high doses can increase bleeding risk. And it may interact with some medications. But instead of supplements, try getting more vitamin E from foods. Good sources include nuts like almonds and peanuts, seeds like sunflower seeds, vegetable oils like sunflower and safflower oil, and green leafy vegetables. Eating these foods as part of a healthy diet may help your blood pressure and overall health. Are you finding this video helpful? If so, please do us a favor. Like this video and share it with people you know who might benefit from it. And please consider subscribing to our channel and hit the notification bell so you get notified whenever we post something new. We're down to the number 1 vitamin on our countdown of the 5 vitamins that can help lower blood pressure. Number 1. Vitamin K. Let's talk about vitamin K and how it might help with high blood pressure. Vitamin K is a nutrient that helps your blood clot and keeps your bones strong, but it might also be good for your heart and blood vessels. A study done on Flemish patients in 2017 and published in the journal Hypertension examined the relationship between vitamin K status, vitamin D status, and blood pressure in healthy older adults. Over a 3-year period, researchers monitored 231 participants aged 60 to 80 years, measuring their vitamin K and D levels along with their blood pressure. The results showed a significant association between vitamin status and blood pressure. Participants with low levels of vitamin K had notably higher systolic and diastolic blood pressure compared to those with adequate levels of both vitamins. Furthermore, the combination of low vitamin K status was linked to increased blood pressure over the follow-up period. While the study doesn't directly prove that vitamin K lowers blood pressure, it suggests that maintaining adequate levels of both vitamins K and D may play a role in blood pressure regulation, particularly in older adults. There are two main types of vitamin K. Vitamin K1, found in green leafy veggies and some oils. Vitamin K2, found in meat, eggs, and some cheeses. In addition to helping with hypertension, vitamin K has also been shown to help improve cardiovascular health. It has been demonstrated that vitamin K might help your heart by reducing inflammation and stopping calcium from building up in your arteries. But we need more research to be sure. Good sources of vitamin K include leafy greens like spinach and kale, broccoli, Brussels sprouts, and vegetable oils. As always, it's always best to get your vitamins from food. But if you're thinking about taking a vitamin K supplement, talk to your doctor first. This is especially important if you take blood thinners, as vitamin K can affect how they work. And there you have it, 5 vitamins that can help lower high blood pressure. We hope you found this information helpful and easy to understand. If you enjoyed this video, please give it a thumbs up, share it with friends, and subscribe to our channel for more health tips. Your support helps us create more videos about important health topics. Now we'd love to hear from you. Are you getting enough of these vitamins in your diet? Do you have any favorite foods rich in these nutrients? Let us know in the comments below. Your ideas can help others in our community make healthier choices. Remember, a balanced diet with these vitamins can help manage your blood pressure. But always talk to your doctor before making big changes to your diet or taking new supplements. If you'd like to support our channel, please consider sending us a super thanks. Every bit helps us keep making useful videos for you. Thanks for watching, and we'll see you in the next video.